I'm here to debunk some myths and legends about COVID-19 vaccines. We're just going to repeat what we already know about COVID, a short form of coronavirus, manifests as respiratory, constitutional, and gastrointestinal symptoms. The respiratory symptoms being the runny nose, stuffy nose as well, sneezing, cough. The runny nose, stuffy nose, you can also call that rhino symptoms, rhino meaning nose. Oral symptoms as well, meaning the sore throat. The constitutional symptoms being the muscle pain, the body aches, the fever, the headache, and the gastrointestinal symptoms, which can also occur in COVID, are nausea, vomiting, diarrhea. Another respiratory symptom is shortness of breath, difficulty breathing. And as you can see, a couple of these symptoms are mostly in COVID-19. Most of these symptoms are in COVID-19. There's a comparison with the flu and then the common cold, which is any other like run-of-the-mill virus. So this is just another comparison because these symptoms can overlap and people get confused. We also have a long COVID symptoms. So I was previously mentioning the acute or short-term COVID-19 symptoms. Long COVID symptoms are symptoms that persist for weeks to months or even years. These include the coughing and breathing problems, the loss of smell, change in taste, body aches, headaches, chest pain, chest discomfort, or stomach pain. Trouble sleeping is a distinguishing factor of long COVID versus short COVID or acute COVID. Brain fog, fever, cyclic fever. So you don't have to have fever persistently, but fevers can come and go if you have long COVID. Fatigue and mood changes. There are also other 200 symptoms that we're discovering more and more as we investigate long COVID, but these are the main ones. The exact mechanism of long COVID isn't truly known, but the long-term inflammation of illness just causes havoc on different body systems, different organ systems. So this is why we can have so many different symptoms in long COVID, but these ones here are the main ones, again, because of that ongoing inflammation from the illness. I think it's just really important to just share how COVID is spread because I think that's part of a myth in a sense. So again, famous T-zone area, that's where all these respiratory particles get at you if someone's talking, coughing, or sneezing in your vicinity, and these respiratory particles travel through the air. That's what the yellow like squiggly lines are. And then as I was mentioning, lands in your T-zones. If it lands around your eyes, your nose, your mouth, you inhale it, you get these respiratory particles in your system on your own surface. That's how you can contract COVID. Aside from being in the vicinity, COVID is a living organism. It can stay on surfaces. Depending on the type of surface determines how long the respiratory particle stays. But this is why it was so important to clean surfaces with antiviral wipes and whatnot. The highest risk in terms of spaces that you can get COVID are small and enclosed spaces like schools, office, public transportations, nursing homes. If you share a bathroom with someone, that's also an enclosed space. So that is also why it's important to aerate, ventilate, open windows in those spaces in order for those particles to escape and not stay in the enclosed spaces, aside from disinfecting surfaces. Let's talk about prevention first, because I typically get into the treatment, but in terms of prevention, hand washing, sing that happy birthday, vaccination, which we're obviously going to talk about later on, and masking. Even though we are bordering 5 to 6 years out from the height of the pandemic, people still wear masks, not necessarily in hospital or enclosed spaces. I still wear a mask in the hospital. I still wear a mask on the bus. I still wear a mask on the subway, not just against COVID, but also other respiratory illnesses. And in fact, there have been studies that because of masking during parts of the pandemic, other types of viruses that people typically get, they weren't getting as often because a mask is protective against respiratory particles from other viruses as well. So if you still choose to wear a mask, that's great. Please don't think that you're alone in that. Masking really does help. The type of mask helps. In terms of treatments, if you do get COVID, as I always say, antibiotics are not for viral infection. Antibiotics are for bacterial infections. And so you might not always get an antiviral to treat COVID. In fact, most people, you treat it like any other virus. We encourage you to rest. We encourage you to stay hydrated, take fluids, electrolyte enhanced fluids, especially if dehydrated, and Tylenol for fevers or muscle aches, ibuprofen also for these muscle aches, steam showers to help decongest you if you have that stuffy nose, and vapor rub also to help decongest you. If you notice, I did not say that any of these treat COVID specifically. Instead, we're targeting symptoms. These are all called symptomatic treatment because we are treating the symptoms of COVID. We hope that COVID typically runs its course like any other virus. It can last anywhere from 3 days to 7 days if you have short-term COVID. Again, it is important to get vaccinated because vaccination, even though it might not 100% prevent you from getting COVID, it significantly minimizes severe illness and hospitalization. And we'll get to that later. So that's it about basic treatment and prevention. Now, let's say, unfortunately, your coronavirus illness progresses. What I mean is that you might get a pneumonia. Now, it might start off as a viral pneumonia, but because your lungs are already a little bit out of commission because you're now fighting off the virus, it's not as strong and robust in fighting off other infections that can affect the lung. One might now get a bacterial pneumonia on top of the viral pneumonia. And then in that instance, that is when you treat with antibiotics. I will take another step back to the antiviral medications. So the different types of antiviral medications are Paxlovid, remdesivir, and molnupiravir. You might not get these treatments in the hospital just because you have COVID, because administration of these antivirals depend on how many days you've had symptoms and whether or not you have other health conditions that might prevent you from getting these antivirals again. But that's a situation for the hospital. And then last but not least, if your oxygen levels are low because your lungs aren't able to intake oxygen and help circulate oxygen in the body as well as they should, some people might require oxygen as well. So again, these are all instances if the COVID virus progresses in terms of illness. I always enjoy this slide because it shows you options in terms of vaccination. You don't have to choose one particular one. So in the US, we have at least 3 companies providing the major ones: Moderna, Pfizer, and Novavax. 2 of these are RNA type vaccines and the other ones are protein based. But the other major point of the slide is to show that COVID vaccination is not just a one-time deal, unfortunately. It is a multiple series of vaccination. And this is because the coronavirus is a very smart living organism that wants to live just like the rest of us. And so it tries to mutate and change itself to evade the vaccines that we've created from the past. And so this is why we have updated vaccines. The first primary series is actually 2 doses. And then after your primary series, you get booster shots. And as I was saying, the booster shots are because the coronavirus is very smart and mutates itself to be smarter than the vaccine. But thankfully, humans are very smart as well and are able to adjust the vaccine accordingly by surveilling the different types of strains. There's the KP2 strain, the Flirt variant, the JN1. This is because CDC experts are evaluating the different strains by the year and adjusting the vaccines accordingly. Best time to get vaccinated is late August, early September, in preparation for the next season before respiratory season comes about. And then the end of respiratory season is around March or April. But really, you can get it anytime, but I'm just trying to give advice on the best time to get it so that you prevent earlier rather than happen later. Some symptoms that people might get after vaccination is soreness at the injection site, fatigue, slight fever, chills, nausea. I'll get to that later in one of the myths and legends about the COVID-19 vaccine. I also like this slide because it's a really nice way to explain how the mRNA vaccine works. If you recall, there are two types of RNA vaccines, the Moderna and the Pfizer. I use this analogy because I think it's helpful. Think of anyone trying to meal prep, but they don't know what recipe to cook, but they have all these wonderful ingredients in their fridge, or they're about to go to the grocery store and get the ingredients. But the bottom line is how the mRNA vaccine works is that it gives your body instructions on how to make the building blocks to fight off the COVID virus. So this is like you subscribing to a meal prep program. They send you the instructions on how to make the actual meal with the ingredients that are already in your own fridge. So it's not changing what you already have. It's just giving instructions as to what you already have and let your body build it on its own. Again, you make your own meal with the ingredients you already have, just need a little help. And it's a more controlled, predictable setting than just scrambling and mixing whatever you got in your fridge. So that's how the mRNA vaccines work. Again, gives your body a set of instructions. Your body makes the proteins and the immune system components it needs to help fight off coronavirus. Here we go. Fact or fiction? COVID-19 vaccines change your DNA. Based on the explanation I just gave about how mRNA vaccines work, that's just supplying your body with instructions and tools, but your body builds on its own. COVID-19 vaccines do not change your DNA at all. Does not enter the main component of the cells of your body to change anything. So that information is debunked, fiction. COVID-19 vaccines make you sick. I understand why people might get confused, but again, this is fiction. At the site of injection, as I mentioned earlier, you might have soreness in your arm. You might have a little bit of a warmer body temperature. You might feel fatigued. People think because they feel these symptoms, they're getting sick. Actually, it's a sign that your body is making those building blocks in the immune system to help fight off the vaccine. This typically lasts like 1 to 2 days at most, compared to an actual illness that lasts 3 to 7 days at minimum. So again, COVID-19 vaccines do not make you sick with the illness or give you another type of illness. Most of the time, if people feel unwell related to it, it's because it's your body's response to the vaccine ensuring that it is making the components. This is a difference. Individual is not getting sick. An individual might feel a bit unwell because their body is making those components. This is a very big difference. If one gets the COVID-19 vaccine, one doesn't need the pneumonia and or flu vaccine. Another fiction, because the COVID-19 vaccine is just for COVID-19. It does not cover bacterial pneumonia or other types of viral pneumonias. It does not cover the flu because the flu has its own vaccine and is a different strain. These are different living organisms, so they need their own separate vaccines. It's like comparing apples and oranges. Yes, they are fruits, but they taste and look different. So if you get the COVID-19 vaccine, you still do need your other vaccine. COVID-19 vaccines cause fertility problems. This is actually also not true. There have been studies showing that women or people who want to get pregnant, transgender individuals who also want to get pregnant, they can still get pregnant despite getting COVID-19 vaccine. COVID-19 vaccines contain microchips that can track your body's movements and location. Absolutely false. We're not at that stage yet in the future where microchips can be inserted into the bloodstream just yet. However, do you know what can track your body movements and location? Your cell phone, especially if you have the location app turned on. I will leave it at that. An individual ingesting or injecting oneself with disinfectant and or UV lamp therapy can treat coronavirus. I feel like I'm in a sci-fi novel. This is very interesting. And notice how I said sci-fi. So again, fiction, none of these help. In fact, I'm sure if you read the warning label or danger label of any disinfectant, including bleach, it will say, please do not ingest because it is unsafe. Spraying alcohol or chlorine on one's body can prevent coronavirus. So this is also a big no. I get it that people might think, okay, it's landing on the T-zone. Let me cover my body. The body is a surface. If we're wiping the tables, it should also work. I'm trying to appeal to others, but I'm still having difficulty following the thought. Your skin is not the same surface as a table, a desk, a chair. And so these alcohol or chlorine products are very irritating. Also, I mentioned earlier that one has to get these respiratory particles inside the body by inhaling or having contact with your skin mucosal surfaces. One, you shouldn't be spraying alcohol or chlorine on your body anyway, because these are irritants on the body in terms of long-term exposure. And again, it's not preventing the respiratory particles from going in your body if someone sneezes or coughs on you. Again, different surfaces, your skin, table, chair. It's not even an apples and oranges comparison. It's literally your skin and a desk. Very different. So again, fiction. Antibiotics and or parasitics. And an example of a parasitic is ivermectin can treat coronavirus. Viruses are not bacteria, and bacteria and viruses are definitely not parasites. So if we have different fruits, we can't treat them the same way, and they don't taste the same. We can't get rid of them the same way. So this is why antibiotics are for bacteria, antiparasitics are for parasitic infections, and antivirals are for viral infections. They're different. This is fiction. It's safer to get natural or infection-induced immunity by getting COVID compared to getting vaccine-induced immunity by getting the COVID vaccine. This is also false. And this information took time to come about. So I understand why people might also be confused with this as well. The risks associated with infection, so getting COVID-19, are far less predictable than the risks associated with the vaccine. So the risks of getting COVID-19 without vaccination, especially, is that, remember the long-term COVID symptoms we were talking about, brain fog, cyclic fevers, shortness of breath, lung disease, sometimes even heart disease, fatigue, aside from the 200 other symptoms. These are your long-term risks, especially with hospitalization and critical illness. So these are unpredictable long-term risks. If you think I'm just going to wait and get COVID-19 naturally, your body's immune response is just so overwhelming because of how the coronavirus affects the body. Whereas if you get a vaccine, that response at worst is the uncomfortable feeling that I was talking about earlier, with the soreness at the site of injection, some fatigue, and then some body aches generally. These side effects typically last a few days, 1 to 2. Now, I am not discounting the blood clots that we had with some of the other types of vaccines in the early stages when we were figuring out how to create the best vaccine. However, that is of the past, and this is why those vaccines were now essentially discontinued and taken off the market. And we have other different safe vaccines. And so immunity, whether infection-induced or vaccine-induced, does wane over time. If an individual decides not to get the vaccine and only wants immunity from natural immunity, that immunity actually lasts for only 3 months. Compared to when you get the vaccine, and yes, your vaccine efficacy or your immunity does wane over time, but it takes at least around 6 months for that to happen. To rephrase that, if one does decide to go for natural immunity against COVID-19, that immunity only lasts for 3 months. Versus if you get the vaccine, that immunity lasts for at least 6 months. So there is a difference. And again, that of getting the vaccine is a more controlled response to building immunity rather than the natural immunity that is less predictable. And so this was a slide about the vaccine efficacy. The dashed lines are talking about vaccine efficacy in folks who are hospitalized based on different age groups. And the solid lines are talking about vaccine efficacy in folks who had critical illness. So in the ICU. And so it is showing that, yes, vaccine efficacy or the strength of the vaccine against immunity does decline over time. But notice how it really goes down at a couple month marks. It really goes down around like the 6-month period. But if you notice, people who get at least a single vaccine and are in the ICU setting, their vaccine efficacy still lasts for a year out. This is why people are saying get the vaccine versus people who don't get the vaccine. Those are more the burgundy lines, and their vaccine immunity is really gone much sooner. This is why people stress get your vaccine and also encourage getting the boosters, because then you rebuild that cycle of immunity again. This is an old slide from data from 2023, but I still just really wanted to show that people are getting vaccinated. We're getting vaccinated in New York by the millions. The reason why it's only from 2023 is that after 2023, they stopped collecting the data. But this is to show that people were getting vaccinated. And it really helps because the degree of hospitalizations and deaths have significantly decreased. We only have like tens and tens of new cases and maybe tens who are hospitalized, and then less than 5 people per day in New York are dying from COVID, which is to show that people are still dying from COVID, unfortunately, but this is much better than our previous numbers at the height of the pandemic. Another shameless plug to please get vaccinated. New year, new vaccine, but why? Because we need to prevent against how smart these coronavirus are getting by the year. And the more people who get the vaccine, the less likely coronavirus is spread to others, because you're not just protecting yourself, you are protecting your community. Because if someone else is not vaccinated and is around you, at least if you get COVID, you are less likely to have critical illness and hospitalization. And hopefully that person around you gets vaccinated as well. But at least you have your own antibodies as well to hopefully prevent you from getting COVID-19 illness. But if you do get ill, you are much less likely to get hospitalized and critically ill. The people who are most at risk for COVID-19 are folks who are 5 years old, less than that, greater than 65, pregnant people, and folks with chronic lung and heart conditions. Vaccines are available at your primary care office. This every time. Protect the babies. Babies can also get COVID-19 vaccines. The earliest they can get it is 6 months. And then, as we discussed in the previous slide, the number of vaccines one gets depends on the vaccine type, the individual's age, and the health status. But most people need 2 as part of their primary series. And then after that, you get the boosters. So please ask your primary care provider about the vaccines, testing, and COVID symptoms. Please join me at Settlement if you need a primary care provider. We're located on 106th Street between 2nd and 3rd Avenue. That's our appointment phone number, and that is my card on the right side. I hope those debunkings were helpful. I tried to play devil's advocate for some of them so that we could kind of get into the minds of our individuals, because we need to meet each other across differing opinions to get a better understanding of where people are at. But sometimes, yes, it can be hard, but it's still important. And so now you know